The life-saving importance of 24/7 critical care nursing for tracheostomy adults and children at home in the community. My name is Patrick Hutzel from intensivecareathome.com, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies, and where we also provide services for families who want to go home from ICU with a loved one with a tracheostomy and ventilation. We also provide services for home tracheostomy without ventilation, home BiPAP, home CPAP without tracheostomy, home TPN, prophysis, etc. Today, I want to share a story from a child that we looked after actually a couple of years ago, and she was an 18-month-year-old girl who, like most of our clients, required a tracheostomy. Now, she wasn't ventilated and eventually had the tracheostomy safely removed, but her case also perfectly illustrated why 24/7 critical care nursing is not just a support service, it's a life-saving necessity. So this little girl was born prematurely and developed chronic lung disease, leading to tracheomalacia and tracheobronchomegaly. These conditions caused her airway to be floppy and prone to collapsing, which made her highly susceptible to respiratory infections and severe respiratory failure. Even though the girl no longer required nocturnal CPAP ventilation, the constant risks associated with her tracheostomy demanded continuous professional care with critical care nurses 24/7. A tracheostomy tube is in constant danger of becoming dislodged, especially in a young child who doesn't understand not to pull or knock it out. In this little girl's case, the tube had a long protuberance that was easily caught. A key point from the actual nursing assessment at the time that we've done to advocate for the 24/7 critical care nurses for this little girl was that because CCRNs are able to reinsert a tracheostomy tube or provide emergency airway management with a bag, valve, and mask device. This is absolutely not within the scope of practice for general registered nurses, let alone for disability support workers. The assessment, the nursing assessment for the little girl at the time highlighted that disability support workers are only trained for practical and domestic duties and have no training in airway management whatsoever. Another significant risk was the constant need for suctioning. Even though the little girl had a spontaneous cough, it wasn't effective enough to clear her airway. Frequent suctioning of the tracheostomy was necessary to prevent life-threatening aspiration pneumonia. A registered nurse is required for this task at all times. A CCRN has the skills to immediately recognize signs of an obstruction, such as sputum plugging, and can resolve the problem on the spot. The assessment, but also then the actual nursing care that we deliver, pointed out that the little girl was fed nasogastrically, basically via a nasogastric tube, which carries its own set of risks. If the tube became dislodged, her feed could end up in her lungs, causing aspiration pneumonia. Continuous monitoring of the tube and feed is crucial to prevent this from happening. Only a registered nurse should perform the reinsertion of a nasogastric tube. And with tracheostomy and nasogastric tube kids, they're pulling out the tracheostomy all the time, or they're pulling out the nasogastric tube. That's just a given. And the risk for either to happen without a critical care nurse there has resulted in deaths, where the NDI has simply turned a blind eye on the funding need for critical care nurses. In a nutshell, the care that we delivered, the nursing assessment for that little girl leading up to it, confirmed that the assistance of a CCRN dramatically reduced the risk of serious complications due to their specialized knowledge, experience, and advanced airway management skills. While this little girl was fortunate to have her tracheostomy removed, her case serves as a powerful reminder of the risks faced by others in the community. Without the around-the-clock presence of a critical care nurse, adults and children with a tracheostomy are at a significantly higher risk of life-threatening emergencies and death. Having a tracheostomy at home requires constant vigilance and professional skilled care. Anything less is a gamble with a person's life and is like flying the airplane with a cabin crew instead of the pilot. And lastly, I have evidence that people have died in the community with a tracheostomy because there were no critical care nurses present 24 hours a day, including children. And the NDIS has been very busy trying to sweep it under the carpet. Also, it's evidence-based. Our service is evidence-based, and that is documented on the mechanical home ventilation guidelines on our website at intensivecareathome.com. In the evidence-based mechanical home ventilation guidelines, it clearly says that only and exclusively critical care nurses with a minimum of 2 years critical care nursing experience can safely look after tracheostomy and or ventilated adults and children at home. Now, with intensive care at home, we are currently sending our ICU and critical care nurses into the home 24 hours a day. We are providing the following: home care services for ventilated adults and children with tracheostomies with critical care nurses 24 hours a day. A genuine alternative to a long-term stay in intensive care or long-term acute care, tracheostomy care for clients without ventilation, home care services for patients on non-invasive ventilation such as home BiPAP, home CPAP, home TPN, which is also known as IV nutrition, home IV potassium and home IV magnesium infusions, IV fluids, and IV antibiotics. We are providing central line management, peak line management, Hickman's line management, as well as port management at home. We're providing nasogastric tube and PEG tube management at home, the use of cough assist machines for our clients for airway clearance at home, palliative care services at home, as well as ventilator weaning at home. We're also sending our critical care nurses into the home for emergency department bypass services. We have done so successfully as part of the Western Sydney Local Area Health District, their In Touch program, saving approximately $2,000 per patient that we keep at home instead of them going to an emergency department. That also means we're in a position to cut the cost of an intensive care bed by around 50%. An intensive care bed costs between $5,000 to $6,000 per bed day. Our service costs between $2,500 to $3,000 per bed day, and we're freeing up the most sought after bed in the hospital, which is the ICU bed. Most importantly, we're improving the quality of life for patients and their families, which is a win-win situation for all stakeholders. Of course, quality of life is much improved surrounded by families and by a team of dedicated intensive care nurses in the home care setting instead of in an intensive care unit. With intensive care at home, we are currently operating all around Australia in all major capital cities as well as in all regional and rural areas. We work with NDIS clients all around Australia, TAC and WorkSafe in Victoria, Department of Veteran Affairs all around Australia. Our clients and we as a service provider have also received funding through public hospitals, private health funds, as well as departments of health. We are having policies and procedures for intensive care at home nursing, and we've built all the intellectual property for intensive care at home since 2012. No other provider in Australia has created more intellectual property when it comes to intensive care at home nursing than we have. This puts us in a position to employ hundreds of years of critical care nursing experience combined in the community. No other service provider in 2025 employs a higher skill level in the community than we do, which enables us to look after the highest acuity adults and children in the community in Australia safely. So if you're at home already, and if you're watching this, or you're stuck in an ICU long-term, or if you're going to hospital and ED all the time, and you realize that you don't have the right level of support at home, or if you are stuck in an ICU, I'll give you a real-world example today how we can help you. One of our first clients when we first got started in 2012 was a client who was at home initially on a ventilator with a tracheostomy with a support worker model 24/7. Of course, support workers are not equipped to look after a client at home on a ventilator with a tracheostomy. That is dangerous and it's simply negligent. Having support workers looking after a client at home on a ventilator with a tracheostomy is like flying the airplane with a cabin crew instead of the pilot, because anyone on a ventilator with a tracheostomy is at very high risk of medical emergencies 24/7, or even at high risk of dying if they don't have a team of dedicated critical care nurses looking after them 24/7 at home. This is actually evidence-based and is documented in our mechanical home ventilation guidelines that you can find on our website at intensivecareathome.com. Think about it. In an intensive care unit in a hospital, you wouldn't have support workers looking after your critically ill loved one or after any critically ill patient on a ventilator with a tracheostomy. So why would anyone in their right mind do that in a home care environment in the community? So this client at the time found out about us eventually, and the ICU that he was basically living in also knew about us and eventually reached out to us. And we were proving our concept with this client very fast. When we worked with this particular client, we sent him critical care nurses 24 hours a day, and he never ever went back into ICU ever again, as long as we were working with this client. We can do the same for you if you're not safe at home and help you with keeping you at home predictably. Otherwise, we would not be in business. Again, the same is applicable for those stuck in an ICU, similar to this case study that I've just given you. Or if you're going back to ED all the time, please reach out to us. We can help you with taking you through the right steps, including how to get funding with different funding bodies. This is also why we are providing NDIS support coordination. We have a team of NDIS support coordinators, and they have a wealth of knowledge. I've done an interview with Amanda Richards, one of our NDIS support coordinators, and I'll put a link to an interview with Amanda in the written version of this blog. We're also providing TAC case management and WorkSafe case management in Victoria with Lucy McCodder. If you're an NDIS support coordinator or a case manager from another organization watching this and you're looking for nursing care for your participants, please reach out to us as well. If you need more evidence for nursing care, we are also writing NDIS nursing assessments with legal nurse, critical care consulting nurses. If you are a critical care nurse and you're looking for a career change and you want to join a very progressive, dynamic, and high-performing team of critical care nurses in the community, we're employing hundreds of years of critical care nursing experience combined. You can join this high-performing team if you are a critical care nurse. If you are looking for a career change as a critical care nurse, we're currently hiring for jobs for critical care nurses in Melbourne, Sydney, Brisbane, in Albury, Wodonga, in Bendigo, in Geelong, in Warragul, in Victoria. If you have worked in critical care nursing for a minimum of 2 years, pediatric ICU, ED, and you have already completed a postgraduate critical care nursing qualification, we will be delighted hearing from you. I do have a disclaimer though, because we are offering a tailor-made solution for our clients, which includes regular staff. Our clients also do want the same staff coming over and over again because they are so vulnerable and so special. That's why we need regular staff. So if you're looking for agency work where you can come and go, this will not be the right fit for you. We are looking for consistency and our clients are looking for consistency. So please only apply with us if you can give us regular and consistent availabilities for shifts and you're really keen on building solid relationships with us and with our clients. If you're an intensive care specialist or an ED specialist, we also want to hear from you. We're currently expanding our medical team as well. We can also help you eliminate your bed blocks in your ICU and in your ED for your long-term patients or for your regularly readmitting patients with our critical care nursing team at home. We're here to help you take the pressure off your ICU and ED beds, and in most cases, you won't even pay for it. Even if you do pay for it, it is so much more cost-effective than what you're paying for in ICU and ED, and you get the same level of care. And if you're a hospital executive watching this and you have bed blocks in your ICU, ED, and respiratory wards, or for home TPN, please reach out to us as well. We can help you eliminate your bed blocks very fast. If you're in the US and in the UK, and you're watching this and you need help, we want to hear from you as well. We can help you there privately with one-on-one consulting and with hiring nurses privately. Once again, our website is intensivecareathome.com. Call us on one of the numbers on the top of our website or simply send us an email to info@intensivecareathome.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell, share this video with your friends and families, and comment below what you want to see next or what questions and insights you have from this video. Thank you so much for watching. This is Patrick Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.